Thank you. Madam Vice President, Excellencies, it is my honor to address the Human Rights Council on behalf of the Working Group on Discrimination Against Women and Girls to present our thematic report, Gendered Dimensions of Care and Support Systems, as well as the reports on our visits to the Dominican Republic and Thailand. I would also like to take this opportunity to sincerely thank the government of Zimbabwe and Armenia for their invitation to undertake a visit to their countries this year, and note with regret that the visit to Armenia had to be postponed due to liquidity crisis. Madam Vice President, at the heart of this report lies a simple truth. Care and support sustain life, and we all depend on them. They are the foundation of our families, communities, and economies. Although care and support should be collective responsibilities, in reality, they continue to fall overwhelmingly on women and girls. This imbalance is not only unjust, it is a violation of human rights and a barrier to achieving gender equality. Women perform more than 76% of all unpaid care work globally. They are the majority in the health and care systems, yet they remain underpaid, undervalued, and underprotected. The COVID-19 pandemic revealed how fragile our care and support systems were and how women and girls suffered from excessive unpaid care and support work. But this crisis is not new. It is structural, rooted in patriarchal norms and economic systems that treat care and support as a private female responsibility rather than a public good. If paid, unpaid childcare and housework would equal at least 9% of GDP, and this should be counted in. If a minimum wage were paid, the total value of unpaid care work would be 3 times the financial value of the global tech industry. The report details how the unequal distribution of unpaid care and support work undermines women's and girls' human rights, including right to education, right to employment, right to health, social security, and political participation. In paid care and support work, women also face discrimination and gender inequality. Women dominate the care sector, comprising 67% of the global health and care workforce, yet they are concentrated in lower paid, lower status roles. This occupational segregation contributes a substantial gender pay gap, 25 to 26% in the health sector alone. In agriculture, rural women perform essential care-related tasks, but remain undervalued and underpaid. These disparities are exacerbated by intersecting factors such as race, migration status, and disability. The report also analyzes the global care chain, the flow of care and support labor from poorer to wealthier countries. Migrant women leave their own families to care for others, often under exploitative conditions. This system is sustained by global inequalities and must be addressed through fair labor laws, social protections, and ethical recruitment practices. Despite providing most of the unpaid and paid care and support work, women and girls do not receive the care and support they need due to poverty, social isolation, multiple forms of discrimination, poor access to housing, lack of health care and social services, violence, and a lack of opportunities to participate actively in society. Excessive unpaid care and support work leads to time poverty, stress, and poor mental and physical health. This report links self-care to human rights, such as rest, leisure, bodily autonomy, and health. It also highlights the importance of collective care, community-based support systems that promote mutual well-being. Ensuring time, space, and resources for self-care is not luxury, but a necessity for dignified care relationships and the fulfillment of human rights. Madam Vice President, the report refers to the CREATE framework introduced in our latest guidance document on substantive gender equality. And we made a graphic for this framework. You can find this graphic in the back of the room. It is a comprehensive roadmap for achieving transformative gender equality. The letter C stands for counter harmful social norms. Letter R stands for redress socioeconomic disadvantages. Letter E stands for eliminate legal and structural barriers. Letter A stands for adopt proactive laws and policies. Letter T stands for transform institutionalized patriarchal power structures. And the letter E stands for enhance the participation and the agency of women and girls. This framework is not theoretical. It is actionable. It urges states and stakeholders to move beyond rhetoric and implement systematic change. Despite the challenges, the report highlights promising practices from around the world. Let me mention a few here. For example, Ecuador recognizes care work in its constitution. China, Mexico, Norway, Canada have expanded child care services and parental leave. Tunisia has extended social security to unpaid caregivers. Bogota's Manzanas del Ciudad offers integrated care services that free up women's time for education and employment. Community-based models in Uganda and Mozambique and Sri Lanka support survivors of gender-based violence. These examples show that change is possible when care is prioritized in policy and practice. Madam Vice President, Excellencies, we need a paradigm shift, one that places care at the center of our economies, our policies, and our values. We must move from a world that exploits care to one that honors it, from systems that marginalize caregivers to ones that empower them, from rhetoric to responsibility. This report concludes with a set of recommendations, starting with the basic request to recognize care and support as a public good, to fully appreciate their economic and social value, to invest in affordable and high-quality care and support services, and to transform social norms to encourage men and boys equally participating in care and support work. Finally, care and support are not charity. They are the foundation of human rights, economic development, and ecological sustainability. States must act now to protect care providers and care receivers alike, and to build a future where care and support are shared, supported, and valued. Madam Vice President, Excellencies, now please allow me to turn to some observations relating to our country visits undertaken. The working group visited the Dominican Republic from 22nd to 31 July 2024. We would like to reiterate our gratitude to the Dominican Republic for its invitation and cooperation. The Dominican Republic has made progress in several aspects of gender equality and respect for human rights, as well as in its normative and institutional architecture, and in connection with efforts to ensure that a gender perspective cuts across all sector-specific policies. There have been improvements in relation to the gap in the poverty rate, adolescent pregnancy, and the number of women elected to office in the most recent elections. Even so, there are still alarming levels of violence against women and girls, entrenched gender stereotypes, poverty and unequal socioeconomic development, and abuses and human rights violations in the migration system, including with regard to the latest migration measures adopted and the number of pregnant and breastfeeding women being detained and deported to Haiti. In addition, legal vacuums in sexual and reproductive health rights continue to be a source of dismay, with the country having one of the world's most restrictive abortion laws. It remains crucial to bring abortion law in line with international human rights standards. It is also urgent to adopt a comprehensive law which addresses all forms of violence against women and girls, as well as a law on equality and non-discrimination. In the spirit of cooperation, we have identified challenges and formulated recommendations which we hope will assist the government in their efforts toward gender equality. Allow me now to turn to some observations relating to the country visit to Thailand. The working group visited Thailand from 2nd to 13 December 2024. We reiterate our appreciation to the government of Thailand for facilitating this visit, though we regret that confidential interviews with women deprived of liberty could not be granted in one prison visit. Thailand has made significant progress in advancing the rights of women and girls, particularly in education, health, and economic empowerment. It has largely achieved gender parity in school enrollment, successfully reduced teenage pregnancy, and increased protections for domestic workers. However, more work is critically needed to promote women's equal participation in political life and prevent gender-based violence, both online and offline. Furthermore, many women and girls facing intersectional forms of discrimination, such as refugees, migrants, stateless persons, indigenous peoples, women and girls with disabilities, LGBTQI+ women and girls, and those from the southern border provinces face significant challenges in enjoying their human rights. The working group urges the government of Thailand to adopt and amend key legislation such as the Domestic Violence Victim Protection Act, the Gender Equality Act, and the Sexual Harassment Act. Furthermore, we encourage Thailand to embrace women and girls in all their diversity and celebrate their contributions to society, amplifying their trailblazing work defending civic space, environmental justice, and the rights of marginalized women and girls. We hope that our findings and recommendations will support Thailand's efforts towards gender equality. We look forward to engaging with member states in the future and encourage positive responses to our request for visits. I thank you for your attention and look forward to a constructive dialogue. Thank you.